I want to reiterate that we indeed have not learned, and our collective responsibility in ensuring a safer and secure world that is responsive to pandemics, epidemics, and public health emergencies of international concern rests in having a transparent agreement that prioritizes equity as a cornerstone to pandemic prevention, preparedness, and response. Equally, I want to reiterate that the North cannot build fortresses around their nations. And by this, I mean building fortresses around their borders. We've seen that with the Ebola epidemic that happened in West Africa, here in Uganda, and with COVID as well. Fortifying and ring-fencing access to vaccines, therapeutics, and financing at the expense of the developing world, where 85% of the world population lives, and where the infectious disease burden is highest, leaving the developing world to beg for therapeutics and for response support can only set the world further back. And especially, we've seen the effects of this, has become much worse in the developing world after COVID. So for Africa, our hope is that the stalling of the negotiations gives us pause to negotiate in good faith and to commit to equity as part of an agreement that is fair to all nations. Africa has been speaking with a united voice, with the leadership from the Africa CDC, and equity, financing, and transparency, whether it is on the issues of pathogen access and benefits sharing, and access to therapeutics and other vaccines, is very critical for the response in Africa. So we hope that with these negotiations that have stalled, that there will be more emphasis put on these issues, and that the agreement that eventually is agreed to will commit to these areas. Thank you.